Well, hello and welcome. This is the Baker Senior Show, and today we have with us Steve Baker, who is going to tell us all about how we're going to be covered with Medicare with this COVID-19 pandemic that's going on. Now, this is a worldwide pandemic, but really and truly today we're just going to be talking about the United States and Medicare and the coverage that is expected and hoped for if you happen to get it. Okay, so Steve, uh, hello, and I hope you're having a good day. You look
I am.
fantastic. Yes,
Thank you.
yes,
Thank you.
yes. So I know
You do
you're
as well. You do as
well.
well.
Thank you. I know that you're excited to help us understand a little bit more about how Medicare will help us through any kind of emergency or illness. And so why don't you tell us a little bit first about you and how you got involved in Medicare? Because if they're brand new to your channel, they don't really know anything about you. So can you tell us just a little bit background about you and how you got into Medicare?
Well, my mother used to tell me when I was young, she had aunts and uncles and stuff, and we went to family reunions and all that. And she said, I've noticed something about you. All your cousins and your brothers and your sisters. Whenever the conversation comes on and the older people sit around and talk about various things and some of the older days, I had a great grandmother that I loved to have conversations with because she came from Arkansas down through to West Texas, covered wagon. So she used to tell me about the covered, and I was really just enthralled with that. And I guess I've been related to older people for a while. I used to work with a health organization. I'll tell you what it was the American Cancer Society years ago, and a lot of the volunteers were older people, but they were a lot older than I, but a lot older. I was like 25 or 30 in that range, and they were like 60s and 70s, and I loved to work with those people. And they loved for me to come around and help them with their volunteer efforts and how do you do this and how do you do that and so forth. So I've always been sort of interested in older people and seniors and so forth. So when the opportunity came for me to get involved with insurance, I was already involved in insurance because I did a lot of life insurance early on and other things in the insurance field as well. So I picked up on Medicare, and it just fascinated me. It really fascinated me. And my parents were on Medicare, and so I could relate to that. And I was much younger. It was going to be many years before I got involved myself personally. But as the time went on, I got more and more interested in it. And apparently, I was attracted to the people, and they were attracted to me, and it had a kind of a fit. So in the earlier years, I was, it wasn't nearly as competitive as it is now in terms of a business, but I built over the period of time, I built up a really, really good business. And so I I've been able to relax a lot and just kind of just talk to people about what's happening and bring people up to date. So this COVID-19 thing came along, and some of my clients were calling me and asking me about it. Will Medicare cover it? And I said, well, of course it will. Hopefully, it won't ever apply to you. But now, as this thing has moved forward, we're seeing that more and more people are being tested. And it just makes sense. If more people are tested, that means there are going to be more and more positives, and that means there's going to be more and more cases discovered. So, but what and I think what people need to understand is the death rate of the COVID-19, not how many new cases there are, and the news media likes to focus so much on the new cases, but people, they had some that's been discovered and they have absolutely no symptoms, none whatsoever. I have an in-law person, and he works in a prison, in a federal prison, and I kept talking to him by phone about, what's it like, what's happening, and so forth. And he really knew all along that he was being exposed. They didn't know what to do because he wasn't a prison guard as such, but he was in the upper management of, the rather large federal prison that he operated in. And sure enough, this week we discovered that he was tested, and they kept testing and kept testing. And sure enough, he came back positive for it. So, but
Did he say what his symptoms were?
He didn't have symptoms. He didn't have symptoms.
And that seems to be the biggest problem for me, is that you can be a carrier. Mm-hmm. So if you're walking around without a mask on, you're harming other people that would get the symptoms and maybe even die from it. So
correct.
I don't think that it's time to just say, it's over, or, like you said, looking at the stats, there's so many different ways people can skew it, right? No matter what the stats are, you can find a way to make it sound like the way you want it to sound. So
right.
Whoever's reporting on it, right?
Right.
I don't think that that's the way to go. So, okay. So I like the story that you brought us up to, how you were attracted to a certain element of our society, which were older people, not necessarily because they needed your services at the time, but just because you had an affinity. You were attracted because of your interests. Maybe your interests weren't, drinking and smoking and carrying on with the teenagers. It was more of, what are the adults talking about?
Right. Right. Well, when I used to go to family reunions and stuff, and I used to listen to them talk, and they talked about in the old days and Model Ts and so forth. Actually, I'm of the age now that my first automobile was a Model A, and I worked in a grocery store, and I paid $50 for my first automobile, and it was a Model A, and it had a rumble seat that folded back. I wish I had that car now, but anyway, they used to talk about the automobiles that they had, and the first automobile that they remember seeing. And in those years, they had enough of my great grandparents or my grandparents, perhaps, who remember the first time they ever saw an automobile.
I talked to my grandmother about that. She grew up in a horse and buggy. And her first experiences with electricity, and they had an outhouse, or her first, we've come a long way in a short period of time, Steve, don't you think?
Definitely.
Now, my first car, I was 16. I was able to buy it myself. I worked at an early age. Go figure, right? And I'm just, one of those people that likes to work. And it was one of those boats. Okay. So we went from the Model T to these boats, and it was a Ford LTD, 4-door, huge of a thing. I could fit 14 people in that car. I know.
Was it air conditioned?
Oh my goodness. I doubt it. That was back before, and I lived in Michigan. So I don't even think even if it would had it, I don't think I would have used it. Right. But we've come a long way in a short period of time, don't you think?
Yes.
Caveman to sending people to the moon.
Yeah, exactly. Yeah, exactly. So anyway, it occurred to me, because I was starting to have conversations about it, and as we speak right now, this it's in the news a lot. About COVID-19.
It really is. Everywhere you turn. And a lot of that is because we want to know, this
Hmm.
is something new. We don't understand it. It's never happened to
Right.
us before.
Uh-huh.
And so we are looking to the news to tell us
Uh-huh.
what to do and what's going on.
So as we're talking now, everything is still the same. It's if you test positive and you start starting to get symptoms and so forth, common sense applies that you need to go see your doctor fairly soon, wearing a mask, of course. We're not wearing them right now because we're not exposing each other, as you know, because of the technology and stuff.
Right.
So
You're
we're able,
miles away from me.
yeah, miles away from you, and I'm in a room all by myself, and so, but it's but typically we would have the mask on and have to talk through it and that sort of thing. But I go out and about and I wear my mask, and everybody's doing that these days. It's kind of important. And right now, where we live, you and I, in the area we live in, we've had some upticks because I think people uh, got out and got around a little early, and now the other thing is that they've started doing a lot more testing. And if you do a lot more testing, then you're going to find a lot more cases. So, it's, and so uh, Medicare, how does it relate to Medicare? It, excuse me, if you go to the doctor and you suspect, or you've been uh, proven that you get a positive result from a test, you want to go to your doctor, and right away uh, you're in a waiting room and so forth, and you wear your mask. But the question comes is, does my Medicare work? And the answer is absolutely yes. It's just like you were going with any other kind of symptom. If if your bowels aren't moving, if you're whatever, you have chest pains or whatever, you better go have this checked out, kind of thing. It's all exactly the same. So the COVID-19 is actually not changing anything in terms of 65 people over 65. And if you have Medicare, you have Medicare. But you all of a sudden you have a symptom that's you've been alerted to a symptom and you need to go have it checked out. You just use your regular Medicare card, whether you're on traditional Medicare with a supplement, or whether you have the Medicare Advantage. It's just like it has been. So you have a PCP, preferred care provider. PCP, that person is assigned you. That's where you go first, and then he or she will refer you to wherever you need to go. And if
So, Steve, let's back up just a little bit so
Mhm.
I'm clear. Because if someone's brand new to Medicare and they haven't been to the doctor yet,
Mhm.
let's say they just got their Medicare card
Mhm.
and they're not sure what to do. Do they call a number? Do they just call their doctor? How do they
They
get
can
covered?
they can go, if you're on traditional Medicare with a supplement, then you can go to any doctor you want to.
Okay.
Most,
So you just
95.
call up your doctor like normal and you show them your Medicare card.
Right, exactly.
Okay.
And you should have the supplement card along with it, because Medicare by itself only pays 80% on that side of the equation. So you get a supplement to go along with it, and that will pay the remaining 20%. So
Okay, good.
that's on one side of the Medicare picture. On the other side is called the Medicare Advantage. Now that's a little more complicated, and you are assigned a primary care provider, and that's where you need to go first, to call them up and see what to do and so forth. And
I have another
they,
question, and you may or may not be able to answer this. So, yesterday on my way to work, I was driving down the road and I saw a long line of cars, and there's little police people,
Mm-hmm.
like the flashing lights and stuff. And I'm looking, what's going on over there? Well, it happened to be a long line of people going to be tested.
Mm-hmm.
So, and it's like a testing site. So it's not a doctor. So
Right.
how does Medicare fit into testing if you just want to get tested?
It all depends on whether you have Medicare or you don't. If you have Medicare, then that's the avenue you go in. That means you're 65 or more in age, which means if you're that age, you need more attention paid to you. If you're under 65, say you're 58 or something, then you have to follow the trail of your insurance that you have, your hospitalization or your doctor's pay or whatever.
Okay, so if
So
you have Medicare, you can get in that line and get tested.
correct.
Okay. Well, I'm glad I asked because I wondered, how
Yeah.
those people even knew to get in that line and why would you? So you must be having symptoms if you're in that line, right? Or
Yes.
like your relative, how did he get tested if he didn't have symptoms?
He just happened to go to what happens is I told you he worked in a federal prison,
Yes.
so they made sure that they tested everybody
Okay.
on a weekly basis
Okay.
because they were exposed to some of the prisoners. Prisoners have visitors, they bring stuff in and so forth, and
Right.
they knew there was a high likelihood that that COVID-19 would be running around in the prison, and he has to go to work and he has to do his duties and he has to walk through areas where there are prisoners and so forth. It's just part of his life. He's been doing it a long, long time, and he's not yet to retirement age, but he's been there a long time. So it was just part of it. So they had to test all the prison employees on a regular basis.
I gotcha. I gotcha. So there's a lot of us out there running around with COVID, but we don't have symptoms. And so that's another reason why we should all wear masks because there's a lot of people out there that if they did get it, they could get very ill and maybe even die.
Right, and it's another reason we need to be tested.
Right.
So.
I agree with that.
Mhm.
So, Steve, I have another question. It's just clarification. So you told us at one time that when you're about to turn 65, 6 months before and 6 months after, you have what they call open enrollment period.
Mhm.
If you go in, let's say I'm going to turn 65 in 6 months, and I call you,
Mhm.
and you get me going on the Medicare. Does that mean I'm covered even before I'm 65,
No,
or
no,
I'm just applying?
no. Your 65th birthday is the trigger.
Okay, good to know.
Let's just say, for example, you're born on October 17th. Okay, so your 65th birthday is on October 17th. As we talk now, as this message is being recorded, the year is 1955. If you were born in 1955, then at your birthday for that year, you turn 65. So if your birthday is on October 17th, you're eligible for your Medicare to begin on the first day of your birth month. So that person's Medicare would begin October 1st.
Got it. Very clear. Thank you very much. So I know you had talked about this.
Yeah.
When you turn 65, 6 months before, you need to call Steve
Hmm.
and he'll get you started on this program.
Exactly.
Um,
Leading up to October. And I say 6 months because it's, the earlier the better. You need to be relaxed, and you need to, have me talk with you and tell you what will happen in the subsequent months. And I'll I could enroll you, go ahead and enroll you in a supplement at that time, but maybe not. Maybe we can wait a little closer. But I do want the education process to start.
because it is confusing, yes.
It is confusing, and it's very important that people don't miss the date. Now let me back up just a second on the birthday.
Okay.
I told you about October 17th, but let's suppose the person is born on October 1st. In other words, we have a birthday that starts the first day of the month, which a lot of people do. In that case, you back up a month. So in that case, if you're born on October 1st, your Medicare will begin September 1st.
See why you need to call Steve, okay?
Right.
And you need to call him. First of all, you need to call him just to get your free Medicare and U book, okay?
Correct.
So call Steve at 832-754-3292.
Mhm.
Talk to him about when's your birthday. Talk to him about getting this Medicare and U book so that when he starts talking to you and something's not clear, you can look in your book and find that you don't want to read the whole book, okay? That would be the most boring book you ever read in your life. But if Steve's telling you that you have open enrollment and you're not really sure what that is, you can go to that section and read more about it.
Correct.
See? You
Yeah.
got it covered, Steve.
There you go. So it's important to start educating yourself early, and a lot of people are in different situations. Some people want to continue to work. A lot of people are working way past their age 65, and they're covered by a group policy. Another situation that we're seeing a lot now, because everything is in disarray in terms of the employment situation with people. There's all kinds of layoffs and furloughs and that sort of thing. And there's a difference between a furlough and a layoff. So you need to understand there. But if you're caught in a situation where you're just not really know where you stand in terms of group coverage and all that sort of stuff, I can discuss that with you. And I have examples of people of clients and upcoming clients as well. I have a lady that's not going to be 65 until September, and as we speak, uh, it's actually June. So we've got a ways to go, and I stay in touch with her. But actually in September we've got to sit down real soon, this month or next month. We've got to sit down and decide what she wants to do. But all along I've been talking with her and explaining her whole situation and exploring with her things that she needs to do leading up to age 65. So the 6 months before and 6 months after is just an arbitrary amount of time that you have to do it. But what you don't want to do is just let your birthday come and go and time drift on for whatever reason. You're busy and you don't want to address it or whatever. That's the very, it's not dangerous, but it's time to really understand when you're going to apply for your Part B. And then as I've said over and over again in these discussions, typically you're going to get your A anyway when you turn 65. But
It reminds me, Steve, of, if you did something wrong, let's say you're driving down the road and you see an accident on your right and the police officer is got his lights on and you just keep driving, right? In the same lane that you are, you just keep driving. And then all of a sudden somebody pulls you over and says, I'm going to give you a ticket because you didn't slow down or get and move over a lane.
right.
And you'd say, well, I didn't know I had to do that. Well, that's no excuse, okay? For the law. That's the law. That's the United States of America. Ignorance of the law is no excuse. It's the same way with Medicare. You need to get with a professional like Steve to make sure that you understand that there are certain times that things have to happen.
Mhm.
Otherwise, it'd be just chaos and no one would know what's going on. They have very specific rules about when you can apply and how long it is that grace period and all that stuff. So don't leave it to chance. Don't leave it to your neighbor to tell you what's going on. Call Steve. And his number, once again, for those listening on the podcast, are 832 754-3292.
Mm-hmm.
It doesn't hurt. Steve is very friendly. He'll answer your questions, and he'll even get on a Zoom call so that you guys can see each other face to face, even though you're totally, miles and miles away. It doesn't matter. Steve can call you on the phone, and when the COVID thing is over, he can even meet with you in person if you're so inclined.
Mm-hmm. Exactly. Yep.
That happened to a friend of mine, by the way. She got pulled over because she didn't slow down or move over when the cop pulled her over. And she went to court trying to fight it. She's like, this is not right. I didn't know. And that's what they told her. It's too bad. I'm sorry you didn't know, but that's the law.
Mm-hmm. Right. Exactly. And if you're lucky at the officer's discretion, he or she may give you a warning ticket, but it's totally up to the officer. So, but a lot of times you do not get a warning ticket, you get a ticket, which means you've got to show up in court. So yeah, you're exactly right about that. But ignorance of the law is something that you've got to avoid.
Right, right. And even though the consequences are totally different, Medicare does have rules and regulations, and you do have to abide by them in order to be covered with Medicare. So I suggest that you call Steve. Well, Steve, do you have any last thoughts about COVID and Medicare that you want to share with us?
No, other than we've just got to get through this thing, and then as time goes on, we'll have all this in a rearview mirror and see what happens. But we'll have a lot of things to talk about for years to come. There's no question about it.
Okay, good. Well, folks, we are here every single Tuesday, and we're live on YouTube and Facebook. So if you want to join in the conversation, we'd be happy to have your questions. There's a little sidebar where you can just type in what you're asking, or you can call Steve or his website. You can go to his website and message him, or he's accessible. Let's put it that way. You can text him, call him, whatever you want to do. Get a hold of Steve and let us know you have questions. We can answer it on the air, or you can talk to him privately. So we're here every Tuesday at 8 o'clock Central Time. We're live on YouTube and Facebook. And then we're on all the podcast apps, all your favorites, of course. So you can take us with you as you're walking the dog or in the car. So we'll see you again next week. Thanks, Steve. You're awesome.
Thanks so much.
Bye for now.
Bye.